Hello everyone, welcome to KNO Academy and also welcome to the MCQ session day 5. So this is Praveen. So in this session we are going to discuss some important questions which were asked in the last previous examinations. So we'll start the sessions. So the first question here is, which of the following actions should the nurse take following a violent episode in a psychiatric unit? Option A, restrain the client. Option B, administer sedatives. Option C, call physician. Option D, call hospital security. So here, so please note the some important terminologies. This question is about violent behavior. So one thing, and the actions. So this question is about actions. So as we discuss this one, alternatives or options, we'll discuss one by one in this. So when we encounter any patient with violent behavior, what we have to do? So with this flow diagram we can able to tell, or we can able to discuss. So first thing what we have to do, so obviously first important point when it comes to the violent behavior which is exhibited by the patient, that is safety. That is the first important point, is ensure safety and clear exit route. And the next priority, obviously we have to show empathy towards the patient. We should not shout in that particular situation, we should show empathetic behavior. Then yes, we have to listen to the patient. Listen to the patient. Then when it comes to the next process, obviously the thorough medical examination. So these are all the four important things that we have to focus. One is the safety and clear exit route, empathy. Option C, the next thing is listen to the patient, then thorough medical examination. So even though the patient, we can't able to maintain the patient, in the sense we have to go for the this one next steps. The next step may be by use of certain like restraints by the means of chemical restraints, that is drugs, and the physical restraints. There are two important things. When it comes to chemical restraints, what we can able to use, obviously everyone know, we can go for benzodiazepine group of drugs. So benzodiazepine group of drugs, for example, you may heard the drug lorazepam. So usually we will give lorazepam, so 2 to 4 mg, the important thing. Then also we can use some antipsychotics like haloperidol injection. Haloperidol also have better effects. So this is about chemical restraint. When it comes to physical restraint, we can apply for physical restraint, but we have to observe the patient. So first 30 minutes after applying the restraint, we have to assess the patient every 5 minutes in the first 30 minutes, and in the second 30 minutes we should observe the patient every 10 minutes, and the third 30 minutes we should observe the patient every 15 minutes once we have to observe. So these are all the various the actions that we can take when we encounter the patient with violent behavior. But the priority in this thing is, that is the ensure safety and clear exit for the staff. So here what it includes, so maybe we can initially we can call security for the safety. So this is the thing what I can able to explain. So with this information we can solve this question. So restrain the client, yes, obviously we should restrain the client, but it's not a priority one, the option. Then administer sedatives, so initially we should not go for sedatives. And the call physician, obviously we should call, but it's not an initial. So initial thing is the safety. So here the safety is the most important thing. So I can go for the call hospital security. Option D is the right answer for this question. Next, question number 2. So the question number 2 is, panic attack is characterized by all except option A, fear of dying, option B, visual hallucinations, option C, choking sensation, option D, fear of losing control. So please do understand the question. This question is about panic attack, and the one more important keyword is except. There are two important things. So here we'll discuss regarding panic attack. What may be the word, what is the typical meaning of panic attack? So the typical meaning of panic attack is it's an acute onset of intense anxiety. So I will write here acute onset of intense means severe intense anxiety. This we can call it as panic attack in a simple sentence. So with this sentence we can understand panic attack. What may be the features? So the features may be like palpitations. The patient may experience palpitations, one thing, and there will be diaphoresis, that is sweating, and shortness of breath also the patient may experience. Then chest pain, usually they feel chest pain. Then there is a fear of death, and there is a fear of losing control. So these are all the various features of panic attacks. So first important thing is it's an intense anxiety. So the thing, it's an intense anxiety. The next thing is the features. Here the features are palpitations, sweating, shortness of breath, chest pain will be there, fear of death. So maybe I am going to die. So like that feel will be there. Then losing control. So there is no control over the body and the thought. Those things we can able to expect in case of panic attacks. So when it comes to treatment for the patient with panic attacks, maybe which includes like initially we can go for SSRI, that is selective serotonin reuptake inhibitors. So particularly in this we can go for like fluoxetine and sertraline, that is also an advisable drug, and fluoxetine. And the one more question we can able to expect here, that is drug of choice. So when it comes to the drug of choice, the selective serotonin is the drug of choice. One more question here, the drug of choice is mainly sertraline or uh, selective serotonin reuptake inhibitors. And the one more thing here, the group of drugs which we are using in this particular situation is the benzodiazepines. Benzodiazepines also we can use in this particular situation. So particularly like loraz, loraz we can able to expect lorazepam, that is 2 to 4 mg. And the main important thing when it comes to loraz is it's an immediate effect, which gives immediate effect. So this is the important thing. But when it comes to the question, the treatment of a drug of choice for the patient with panic attacks, that is selective serotonin reuptake inhibitors. If the question says, so the immediate effect in the sense like benzodiazepines group of drug like lorazepam. So those things we can able to expect. And one more thing, the therapy of choice. The therapy of choice here is, that is CBT, cognitive behavior therapy is the therapy of choice for the patient with panic attacks. So with this the wholesome information we can solve the question here. The panic attack is characterized by all except, so fear of dying, option A is there, yes, it's a feature. Then option B, visual hallucination, we will wait. Then option C, choking sensation, yes, it will be there. Then fear of losing control, yes, that also will be there. When so here except is there, so the correct the option for this question is visual hallucination. So the patients who are experiencing panic attacks, they are not going to experience visual hallucination. Yes. Next, question number 3. So the question number 3 is temporary loss of muscle tone and weakness precipitated by a variety of emotional state is called. Option A, cataplexy. Option B, catharsis. Option C, compulsion. Option D, confabulation. So in this option we can expect 4C. So we'll understand the question first. So there is a temporary loss of muscle tone. So muscle tone loss and weakness. So emotional state. So these are the keywords. And 4C. Yes. So we'll discuss with a note. Yes. Before that, we should understand this. So the sleep disorders, which is broadly classified under two headings. So sleep disorders, which affect the sleep-wake cycle. Sleep disorders which affect the sleep-wake cycle. There are two important classifications we can able to expect. One is sleep dysomnias and parasomnias. There are broad two classification. So first one, when it comes to dysomnia, here the concept is there is an abnormality of quantity and quality of sleep. So here abnormality of quantity and quality of sleep, that we can call it as the dysomnias. And para means abnormality. So here when it comes to parasomnias, this one may be here partial arousal. Parasomnia, partial arousal. Yes. Dysomnias. When it comes to dysomnia, again we can able to expect two important conditions. One is the very familiar insomnia, and the one more thing is hypersomnia. So insomnia means decreased sleep. Then hypersomnia means increased sleeping episodes. Increased sleep or sleeping episode. Here only I will write. Yes. Okay. So with this information, we can go with the one more terminology, that is narcolepsy. So what it is narcolepsy? So narcolepsy, it is a neuro condition. First of all, it's a neuro condition. Then what it is? So it's a REM disorder. REM in the sense rapid eye movement disorder, which is a sleep disorder. REM disorder, and it comes under hypersomnia. So it comes under hypersomnia. Yes. So when it comes to narcolepsy, there are four important features. Four features are there. As I mentioned ABCD, there are four features are there in case of narcolepsy, which is a neuro condition, which is a rapid eye movement disorder. So the four disorder symptoms or features may be like the first one. So the first one, which is like there is just imagine a patient, he is having strong urges of excessive daytime sleepiness. So excessive urges of excessive daytime sleepiness. So this particular term or condition, we can call it as sleep attack. So we can call it as sleep attack. One thing. And the second one which is related to our question, that is sudden loss of muscle tone. So here what happens in case of second feature? In the second feature, there is a sudden loss of muscle tone. Then what happens? Then obviously person may fall. the patient or person may fall. Person may fall. So which is due to? Why he fall? So it is due to emotional outburst. That is triggered by emotional outburst. So this feature we can call it as cataplexy. Yes, cataplexy. Next next feature C. So in case of feature C, here the most important thing when it comes to the feature C is, so person may wakes up after sleep but can't able to move. So this we can call as sleep paralysis. Here what will happen? So person wakes up but is unable to move. So unable to move the body. So this we can call it as sleep paralysis. Sleep paralysis. So this is feature 3. Then the last feature is, there are two important words we can able to expect here, that is hypnagogic and hypnopompic hallucination. So next is hypnagogic hallucination and hypnopompic hallucination. So hypnagogic means while going to the sleep. So hallucination, so while the patient may experience hallucination, so while going to the sleep. So here going to the sleep. Hypnopompic means coming out of the sleep. Coming out of sleep. So these are all the 4 important features of narcolepsy, that is sleep attack, cataplexy, then sleep paralysis, hypnagogic and hypnopompic hallucination. So with this information, we'll see this question. So temporary loss of muscle tone and weakness preceded by a variety of emotional state is called as, so it's not confabulation, it's not compulsion, it's not catharsis. The right answer here is cataplexy. It's a temporary loss of muscle tone. So what is catharsis? Catharsis means it's a psychotherapeutic technique. It's a psychotherapeutic technique, particularly psychoanalytical. So particularly psychoanalytical technique. So usually what they will do in case of catharsis, they will focus on emotionally charged areas and they will relieve the emotional charge areas. This is the concept of catharsis. Compulsion means the you may heard this word, the repetitive activities, that is compulsion. Then confabulation means it's a memory disturbance where unconscious filling of memory gaps. Memory gaps with falsified information. So this we can call it as confabulation. Yes. So the question number 4, state of diminished unconsciousness in which the patient remains mute and still with the eyes open is called. Option A, catatonia. Option B, stupor. Option C, panic. Option D, hysteria. So we'll see the each option here. The main technical or keywords are, it's an like a patient becomes mute, one thing, and eyes open. So these are the two important the keywords you should focus. What is catatonia? First option is catatonia, that is kata means disturbed, tonia means movement, very simple. So here kata means disturbed and tonia means movement. It's a broad terms. Then option B, what is stupor? Stupor here, like the person may believe that the person may appears like unaware of, and so here the patient is not react to surroundings. First thing, not reacting. Surroundings. Then so he appears as unaware. Appears as unaware, one more point, and like is not interested, and eyes opened. So this we can call as stupor. Then panic in the sense, panic means intense anxiety. So acute attack of intense anxiety. So this is panic. Then hysteria means, so it's a broad term. Hysteria means broad term here, which includes a group of disorders, maybe like dissociative disorder, conversion disorders, and even somatoform disorder. Those things we can able to explain when it comes to hysteria. But when it comes to the question concern, so here the right option, it's not option A catatonia, it's not option C panic, it's not option D hysteria. So the right answer for this question is option B stupor. So some additional information related to the hysteria. What it is, hysteria means, sometimes we can able to expect question in this, so that's why I prepared some notes on this hysteria. Here the main concept of hysteria is, so when there is an conflict which is unconscious, so to resolve that unconscious conflict our mind produces body symptoms. So I will write, so for example, some conflicts like to resolve unconscious conflicts. Our mind produces what it produce bodily symptoms. So why it is produced? To relieve the anxiety. So this is the main feature when it comes to hysteria. What and all it includes? It includes like dissociative disorders, dissociative disorders, then conversion disorders, and even like somatoform disorders. Somatoform disorder. So togetherly we can call it as hysteria. So this is the concept of hysteria. So here we can able to expect question. Yes. The next question number 5. When a patient is not aware of his or her mental illness, it is called option A disorientation, option B lack of insight, option C unconsciousness, option D lack of concentration. So here the concept is not aware of his or her mental illness, what it is. So here disorientation means the patient is not aware or not oriented to time or place or person. We don't know exact time, we don't know the place where he is, we don't know the surrounding peoples who are all there. So this is, we can call it as disorientation. So option C unconsciousness, obviously the patient is not conscious. Then lack of concentration, option D is lack of concentration. So it's not the particular related words for this question. When it comes to lack of insight, first we should know the meaning of insight. Insight means aware of his illness. The typical meaning of the insight is awareness of his or her illness. This is the meaning of insight. Here they mentioned when a patient is not aware of his or her mental illness is called as lack of insight. Lack of insight. Option B is the right answer. So the insight is present, where it is present. One more question, two important question we can able to expect. So insight present in, absent in. So present, insight is present in neurosis or neurotic conditions. The person, they know he is having some mental illnesses. The person, if the person does not know what he is suffering with, so that we can get lack of insight, we can able to expect in case of psychotic condition. For example, for psychotic condition like schizophrenia is the example for lack of insight. Yes. Next question number 6. Temporary discharge of the patient from psychiatric hospital is referred to as option A parole, option B abscond, option C termination, option D escape. So here they mentioned one of the important term, that is temporary discharge. So usually the temporary discharge we can call it as the parole, one thing. So but I will write here parole. Parole means temporary discharge. And temporary discharge. And one more thing is, according to MHCA 2017 Mental Health Care Act 2017, so it's a duty of medical officer in charge of psychiatric the hospital, he can able to give the permission. Why they are sending the patient? Because for like some rituals or some legal aspects, so they are giving permission to the patient to go to their home. So giving permission to the patient to visit home. So this we can call it as parole. So ಇದನ್ನ parole ಅಂತ ಕರಿತೀವಿ, one thing. And for here in MHCA 2017, nothing they mentioned about parole. Here they mentioned one more important term, that is leave of absence. Leave of absence. This term they used in case of MHCA 2017. And one more thing, some acts, for example, like Acts 87, Act 89 and Act 90. They mentioned the rules as per the Act 87, 89 and 90 as per MHCA 2017. So this is the some information about parole. So the right answer here is the parole for this temporary discharge. It's not abscond. Abscond means without information. Termination, which is not related to this particular concept. Then escape, that is also is missing. Next question. Question number 7. If the activities done by the people are repeated by a patient, it is called. If the activities done by the people are repeated by the patient, it is called. So this is the question number 7. So option A, echolalia. Option B, hyperactivity. Option C, compulsion. Option D, echopraxia. So echo, we'll see one by one. Echolalia means repetition of words or phrases. Repetition of words or phrases by the patient. So this we can call it as echolalia. Hyperactivity means that's increase in the psychomotor activity. Increased psychomotor activity. Compulsion means repetitive actions. Echopraxia means repetition of actions or activities which is done by others. So if the patient who is mimicking the actions of others, that we can call it as echopraxia. For this question, the right answer is echopraxia. Echolalia, so don't confuse here. Echolalia, repetition of words or phrases. Echopraxia means repetition of actions or activities. Next, question number 8. Question number 8. A false memory that the patient believes to be true is option A, confabulation. Option B, fugue. Option C, cataplexy. Option D, anergia. So we'll discuss one by one here. So the main keywords here is false memory, which is believed that it is true. So we'll start from the down. What is anergia? Anergia means A means absence, energy or lack of energy. So here lack of energy or motivation. That is called as anergia. Okay, and cataplexy, already we discussed in the last question. Cataplexy means sudden loss of muscle tone, which is sleep disorder. Sudden loss of muscle tone that leads to fall of the person, which is due to triggered by emotional outburst. So that we can call it as cataplexy. Then what is fugue? Fugue means, so here unexpected travel. Fugue means is a dissociative disorder which is unexpected travel away from home. So one thing is the patient may went somewhere unexpected. It's not an expected, it's a unexpected travel away from the home and with new identity. Yes, that is important. With new identity. And one more thing is here they are not able to recall the past, unable to recall the past, the past. So this is the typical meaning of figure. So here I will give an example for this figure because that is very important when it comes to MCQ point of view. Figure means, you just imagine my name is Praveen. So if I am from Mysore, and if I went I went, which is unexpected, I went to somewhere, like I went to Koppal, which a new identity, my actual name is Praveen, but when I visit the Koppal, I became Prasad or Darshan. So this new identity, but I can't able to remember my original name, that is Praveen. So this is the concept of figure, so which is a dissociative disorder. And the one more important term here is confabulation. What is confabulation? Confabulation means unconscious filling of memory gaps. It's a unconscious filling of memory gaps by falsified information. Falsified information. What it is, what is the meaning of? So here also I can able to give one example. A child, it's an example. A child may tell, we went vacation trip during childhood. So during when I was in the like fifth standard, I went to foreign trip. The patient may tell, or the child may tell, but in reality it is not happened. It's never happened. But the this memory gap which is filled by falsified information. So this we can call it as confabulation. When it comes to the question concern, here the right answer is question number for question number A, sorry, question number 8, the right answer is option A, that is confabulation. Next, question number 9. Question number 9, a condition in which person maintaining the body posture into which it is placed is option A, anergia, option B, echopraxia, option C, cataplexy, option D, catalepsy. So there are confusing words, option C and option D, cataplexy and catalepsy. So what may be the concept here? So already we discussed the meaning of anergia means like lack of energy, decreased or lack of energy or motivation. Echopraxia means mimicking or repetition of action or activities, that is echopraxia. Cataplexy which is a sleep disorder, then so catalepsy, now the very important term which is a catalepsy, what it is. So here catalepsy means it's an the patient is maintaining, the patient maintains odd posture for long time, is called as catalepsy. So please don't confuse between cataplexy and catalepsy. Cataplexy which is a sleep disorder which is sudden, but catalepsy which is a like a movement disorder, so which is a main feature of schizophrenia here. And one more question we can able to expect here. So if the odd posture here is, if the odd posture, if it is passive means which is given by someone else, passive, so that we can call it as catalepsy. The odd posture which is passive, that one second, that we can call it as catalepsy. If it is active, the odd posture which is active, that we can call it as posturing. One more important terminology, posturing. So here also question we can able to expect, in this also question we can able to expect. So the odd posture odd posture which is passive. The odd posture, if the patient maintains odd posture which is passive in the sense like which is given by someone else, for example nurses. While giving injection, we taken the hand of the patient and we give an injection. So if the patient maintains the hand in the same position, that we can call it as catalepsy. So if it is active, it is not from the external factor, so that we can call it as posturing. So this is the concept. When the question concern, so the right answer for this question is option D, that is catalepsy. Next question is question number 10. Abnormal involuntary movement which occurs suddenly, repetitively and purposefully, so is called as option A mannerism, option B compulsion, option C cataplexy, option D tic. So please focus on important words here. So the important words may be like here suddenly, repetitively and purposefully. So this is also one technical words. So these are the technical words here. So one by one we'll see. So mannerism. So here what is the concept of mannerism? Unusual or repetitive behavior or movements. Repetitive behavior or movements. So this is the meaning of mannerism. Then compulsion, that is repetitive activities. Repetitive activities, that we can call it as compulsion. So as already we discussed, cataplexy means it's a sleep disorder or sudden loss of muscle tone. Sudden loss of muscle tone. Then when it comes to tic, what it is? Tic means sudden, rapid and recurrent motor or like verbalization. So here it's a condition where there is a sudden, rapid and recurrent motor movement and verbalization. So this we can call it as tic. It's like, for example, usually it is common among the children's here. So here the tic we can classify under two headings. One is motor tics, based on the features motor tics and vocal tics. Motor tics and vocal tics. Like some features of motor tics which includes like eye blinking. Eye blinking is the one of the feature in this. Then facial grimacing. Facial grimacing also one of the feature. Then head jerking, like movement of head. Head jerking. Jerking means movement. Head jerking is also one of the feature. Here the main features. When it comes to verbalization or vocal tics, like repetitive coughing behavior or like throat clearing behavior, and barking behavior and sniffing behaviors. So these are all the various features when it comes to vocal tics. So here they mentioned abnormal involuntary movement which occurs suddenly, repetitively and purposefully. So it's not mannerism, it is not compulsion, it is not cataplexy. The right answer here is tic disorder. Option D is the right answer for this question. Next question, question number 11. Question number 11, abnormal sensitivity to light is known as. So the very like simple question which was asked in the JIPMER examination, so 2012. Option A, aphasia. Option B, photophobia. Option C, hydrophobia. Option D, diplopia. So diplopia means double vision. One thing. Then hydrophobia means hydro means water, fear of water. Then photophobia means fear of light. Then aphasia. What is aphasia? Which is a very technical word. Here, absence or impairment. Absence or impairment of the ability to communicate. So here the person is not able to communicate. So how? Through for example, speech means he can't able to speak one thing, and the next day he can't able to writing, and he can't able to understand the signs. So this is the typical meaning of aphasia. Aphasia means the person is having, or there is an absence or impairment of the ability to communicate through speech. He can't able to speak, he can't able to write, or he can't able to understand the writing, and he can't able to understand the different signs. So when it comes to the question, so here abnormal sensitivity to light is known as. So here obviously the right answer is photophobia, but the important aspect aphasia also the one of the expected question. So aphasia. Next question number 12. Like a form of speech in which the client tends to wander away from the intended point and never returning to the original idea is called. Option A, verbigeration. Option B, tangentiality. Option C, thought insertion. Option D, thought block. So the question number 12. So we'll see one by one because this is the important terminologies they mentioned. So the option A, verbigeration. Here you can able to expect verbigeration. Verb means that is the words. So here what will happen? There is an senseless repetition of words or phrases. Here the person or the patient is repeating the same sentences or words again and again. So this we can call it as verbigeration. Here I will write some important point. Senseless repetition. For example, the patient may tell Praveen. Senseless or repetition. Senseless repetition of words or phrases over and over again. So this we can call it as verbigeration. Then option B, tangentiality. So what it is tangentiality? Here the patient may touches the topic, goes away from the goal, is not reached. So the meaning is quite very simple. Patient touches the topic but goes away from the goal, and it is not reached. What is the meaning here? So here the meaning is quite very simple. For example, one question. Famous actress. I will ask one question. Famous actress in Kannada. famous actress in Kannada, I will ask. Or who is a famous actress in Kannada film industry, like that I will ask. So patient may tell. So response, patient response may be like he will tell first, like KGF he will tell. And next the same question I will repeat, famous actress in Kannada, next he will tell Yash. Next same question I will repeat, because I can't able to I didn't get the right answer in this. So then he will tell like Sudeep. Here the concept is quite very simple. He touches the topic, he know, like the famous actress which related to film industry. So here film industry like KGF and yes, those people are working in the film industry, but he's not able to reach the goal. He can't able to tell the any female actress name. So this is the thing. So this is the example for this, the concept tangentiality. Then thought insertion in the sense what it is. So here when it comes to thought insertion, I will write here thought insertion. So the patient believed that someone is like inserting thoughts. Obviously it's an abnormality in the possession. First important point is it's an abnormality in the possession. It is also one question, one thing. So abnormality in the possession, one thing. Here what will happen, so our thinking is our own. Whatever we are going to think, it's our own thinking. But here the patient will believe that someone is controlling the thought or thinking, controlling the thought by someone. This is the main feature when it comes to thought insertion. Okay, so next the last option, that is thought block. What is thought block? Here it's a problem with thought continuity. So here problem with continuity in the sense like there is an, like he will start something, he is telling continuously, is telling, then there is an pause, here pause, then he will start with new topic. He is telling something, he was telling something, then there is an pause, then he suddenly will stop in the sense here thought block. So thought block happened, then he will start the new topic. So this is it's commonly seen in schizophrenia. So seen in schizophrenia. So here this also question we can able to expect. Then thought possession, it is also question, and like so even verbification also question, and even tangentiality also question. So here we can able to expect around 3 to 4 question. So for this question the right answer is tangentiality. It touches the topic but goes away from the goal. So it's an important topic. I thought I should add some important points here. So the thought disturbances. So here I should have like some important points that I need to add in this particular slide. So the thought disturbances, which is broadly classified under 4 headings. So the 4 headings may be like flow or stream, problem with the thought flow and thought stream. Then second option is, no, it's not option, the second thing is content. Thought, there is a problem with the thought content. Then there is a problem with the form, and there is a problem with the possession. So these are the 4 important area where thought disturbances we can able to expect. Okay, so first one, so flow or stream. What is flow? So as we are getting continuous flow, so that's why we are talking with the same manner, in the continuity manner. But when it comes to the obstruction, any obstruction happened, there is an like inadequacy, or there is an like blockage in the flow. Again this the flow or stream, again it is broadly will classify. We can classify under two headings, under like speed and also continuity. Speed and continuity, like this we can able to classify. When it comes to speed, again when it comes to speed, if it is increased speed and decreased speed. When it comes to increased speed, we can call it as flight of ideas, FOI I will write simply. And also we can call it as proximity. One more thing, proximity, one more condition. If it is decreased speed, again that is retarded thought and circumstantiality. This I will write. So these are the various the important terminologies when it comes to flow or stream. So here when it comes to speed, there is an, if it is increased speed, that is flight of ideas, then proximity. If it is decreased speed, that is retarded of thought or circumstantiality. One more. When it comes to continuity, the problem like here we can call it as perseveration. One condition is perseveration. And the one more terminology, that is thought block, as we discussed in the last slide. Thought block. And next aspect is content. What are the different problems when it comes to content? So when it comes to content, the different problems may be, so we'll first one, the very famous delusion. Then overvalued ideas, that's also one of the problem under content. Then preoccupation. So these are the problem in the thought content. Okay, next aspect is like form. When it comes to form, the formal thought disorder, you may expect formal thought disorders. Here we can able to expect multiple problems in this. So the multiple problems like here loosening of association, one thing, then derailment, then tangentiality, then neologism, then one more thing like Ganser syndrome, then word salad, then word approximation. So these are the various the abnormalities when it comes to formal thought disorder. Then last one, possession, means the thought which is controlled by someone else. They thought like our thinking which is controlled by someone else, like some important condition like thought alienation. Under thought alienation, we can able to expect like thought insertion, one term, then thought withdrawal, then thought broadcasting. So these are all the various the abnormalities. So in this, so we discuss all these things. Here the main question we can able to expect in case of circumstantiality, obviously delusion, even perseveration is also important. Then in this thought alienation conditions like thought insertion, withdrawal and thought broadcast. So here also some important thing like Ganser syndrome is also important, word approximation condition, then loosening of association. So in this the conditions we can able to expect questions. Okay, so in the further this one next classes, if the question as in the particular topic, we'll discuss regarding particular words. Next question, question number 13. All of the following result in delirium except, like option A benzodiazepine withdrawal, option B like opioid withdrawal, option C hyponatremia, option D like depression. So when it comes to delirium, the concept of delirium. So delirium, which is a organic brain disorder. What the main feature here? There is an impairment in mainly like consciousness and impairment in consciousness, memory, perception, means cognitive function, perception, then even attention. So we can able to expect all these things when it comes to delirium. So this delirium is result of like benzodiazepine withdrawal, yes, opioid withdrawal, yes, hyponatremia, that is decrease in the sodium levels, is that is also true, then depression. So it's not a right thing. So when it comes to the question concern except, the right answer is depression. Next question number 14. Schizophrenia client who is experiencing thoughts of having special powers states that I am a messenger from another planet and can rule the earth. The nurse assessment this behavior as. So it's a very technical question. So here messenger from the another planet. So it's a idea of reference, thought broadcasting, delusion of persecution, delusion of grandiose. What it is? Here idea of reference. Idea reference means the patient is going to refer to like outside thoughts. That is idea of reference. Thought broadcasting means it's a problem with thought alienation. Thought alienation. So here the main concept is thought under someone's control. Our thought is under someone control, like that they will think. Delusion of persecution means someone is planning to kill the patient, kill him or like harm him. This is the persecutory delusion. So delusion of grandeur means, so he believed that it's a delusion where like he is having the false belief or like a firm belief of supernatural power. Then increased wealth and famous leaders, he knows famous leaders, like that he thought. It's a delusion. Leaders. So when it comes to this question, the right answer is delusion of grandeur. Next, question number 15. Services aimed at reducing the prevalence of illness by shortening the course of illness is called as. So option A secondary prevention, option B primary prevention, option C tertiary prevention, option D primordial prevention. So we'll discuss some important points related to this question. So first one is primordial prevention. Primordial prevention means, so what it is here, the main focus is prevention of emergence of risk factor itself. So I will write here prevention of emergence of risk factors. That is the main focus here. Okay, so next, 2 primary prevention. So primary prevention in the sense here, like the main aim is decrease the risk factors. One more thing, and increase the protective factors. Like protective factor in the sense like health education, through health education and even lifestyle changes. Through lifestyle changes he can able to achieve the good health or mental health, good mental health. Next, secondary prevention. So secondary prevention in the sense here, so that is detecting the mental illness as early as possible, that is detection of mental disorders early, that is early detection, one thing. And the one more thing is prompt treatment. Next, the tertiary prevention. When it comes to the tertiary prevention, the main focus here is, that is recovery. So here my main focus is like recovery, and also prevent complication. Prevent complication, one thing. So here main focus is decreased disability we have to decrease, and rehabilitation services, which is comes under tertiary prevention, and decreased remission and relapses. Remissions. So these are all the various things, various important points related to preventive strategies in the psychiatry. So with this information we can solve this. Services aimed at reducing the prevalence of illness by shortening the course of illness is called as, so it is called as option A, that is secondary prevention. That is a good right answer for this question. Next, question number 16. What is the total score in mini mental status examination? Option A 25, option B 30, option C 32, option D 35. So in the same the question, in the same topic, one more question is there, question number 17th, that also we can discuss. Mini mental status examination is a method to investigate common psychiatric problem, B 30-point program to evaluate cognitive function, option C like to evaluate schizophrenia, option D instrument to measure delirium. So what it is, we'll discuss some important points related to mini mental status examination, that is MMSE. So the mini mental status examination here, it's a screening tool. First point is it's a screening tool, first important thing. And the total score is 30. So and here we are going to assess cognitive function. One more important point. Then if the score less than if the score is less than 24, but it suggests dementia. It's not dementia, it suggests dementia, not delirium. So it's also important. So the total score is 30. It's a screening tool. Then it is going to assess cognitive functions. So there are three important questions here. Then what are the different the headings under MMSE? So the different headings under MMSE is, so first one, orientation. For orientation, the maximum score is 10. Then for registration, the maximum score is 3. Next, for recall, the maximum score is 3. Then for concentration assessment, for the assessment of concentration, the maximum score is 5. Next, for the assessment of language, the maximum score is 9. So the total 13, 16, 21, 30. So total it is 30. Okay. So with this information we can solve this question. So a method to investigate common psychiatric problem? No. Next, to evaluate schizophrenia? No, it's not a tool for to evaluate schizophrenia. Instrument to evaluate delirium? No, it's an instrument to, it's a screening tool to assess the like dementia, not delirium. It's a 30-point program to evaluate cognitive function. The right answer for this question is option B for 17th question. For 16th question, what is the total score in mini mental status examination? As already I told, it's not 25, it's not 32, it's not 35. The right answer is the 30. Option B is the right answer. So yes, this about the today's session. So wishing you all the very best for your the preparation. So thank you.